This video is about the fabrication of a diagnostic guide, which is the first step in the GuideWrite protocol to make a surgical guide for a simple single implant case replacing number 9 with an implant-supported restoration. We will be covering the single bend, use of a protractor, and the use of the bending tool. A pencil line can be drawn on the cast to indicate the proposed osteotomy axis. A hole is drilled through the prosthetic planned long axis of the implant into the cast with a 3/32 drill which will fit into the lab handpiece. The drill is removed from 3/32 hole. The cast is lubricated with petroleum gel or Primatech lubricant for easy removal of the diagnostic guide and, if necessary, undercuts are blocked out with wax. A 3 mm guide post is placed in the hole made with the 3/32 drill. UV resin gel made by Primatech is applied to the cleat on the guide sleeve and lingual and incisal surfaces of the adjacent teeth to capture the cleats and light cured to form the diagnostic guide. The guide with the guide sleeve is securely seated in the patient and an X-ray taken. A cone beam X-ray is needed to determine if corrections are needed in both planes. The radiograph taken with the initial diagnostic guide in place indicates a correction is needed to avoid hitting the root of the adjacent tooth with the osteotomy and implant. A protractor placed over the pre-op diagnostic X-ray indicating the proposed angle correction of 9 degrees, which would position the implant to center it between the two adjacent teeth. This is a diagram of the bending tool stylus with an offset guidepost inserted. The post is inserted into the stylus. The guidepost is tightened with 2 set screws as shown. Both need to be tightened against the guidepost to make the bending corrections accurate. This is another diagram of the stylus with the guidepost in it. There is a registration mark on the square platform that will be visible when the post is inserted correctly. Use the 0.035
This video
is about the fabrication of a diagnostic guide, which is the first step in the
This is a diagram of the parts
to make
of
a
the bending
surgical
tool,
guide,
which
for a
include the
simple
bending
single
plate with the
implant
degree
case,
marks like a
replacing number
protractor
9 with
to
an
measure the angle of the
implant-supported
bend.
restoration.
The support
We
bar
will
that
be
is used
covering
when
the
a second
single
bend
bend
or
use of a
correction is made,
protractor,
the two
and the
drivers
use of the
and the
bending
stylus,
tool, the stainless steel bending block, and the socket cap screw which holds the guidepost tight when it is being bent. The red driver that fits in the socket cap screw, and the 0.035 driver with a black handle for tightening the screws on the stylus. To bend a guidepost, according to the degrees indicated from the software evaluation, pressure is applied to the point of the stylus to bend the post 9 degrees according to the protractor marked in single-degree increments. This slide shows the cast with the guidepost inserted before and after the angle correction. To fabricate the final surgical guide, a 3.3 mm open guide sleeve, which was used for teaching only and is now discontinued, is placed over the corrected guidepost, which was bent 9 degrees. Frontal view of the components in cast are 2-piece 3 mm 9 degrees angle corrected guidepost, upper removable part, and the 3 mm guide sleeve. Primatech light cured gel is applied to the cleat and cured, then Primatech splint. A thick rope-like resin is applied and cured to form the final surgical guide. The corrected surgical guide was placed in the patient and an X-ray taken to demonstrate the difference between the initial diagnostic guide on the left and the corrected surgical guide on the right. Prior to surgery, the surgical guide with the 3.3 mm open guide sleeve is disinfected and is securely seated in the patient. This is the clinical view of the pilot drill with 2.9 mm depth stop shaft in the 3.3 mm open guide sleeve. After the 2 mm tapered depth stop drill is used, the alignment is checked with a 2 mm direction indicator. The X-ray of the 2 mm direction indicator in place to check the alignment of the 2 mm osteotomy indicates a satisfactory placement. Now the use of successive larger drills can proceed. Next, a 2.5 mm drill is centered in the 3.3 open guide sleeve. The recommended replacement products, a 3.9 mm angle cut guide sleeve, could also be used with the set of the 3.9 mm depth stop drills. This is the set of 3.9 mm depth stop drills. All drills in the kit have the 3.9 mm depth stops. They are to be used for guided open flap surgery or for guided flapless surgery, with 4.0 mm guide sleeves. The 4 rows of drill have diameters tapered from 1.5 to 2.2 mm, 2.0 to 2.9 mm, tapered 2.7 to 3.2 mm, and 2.8 to 3.7 mm. The lengths of the drills are 6 mm, 8 mm, 10 mm, 11.5 millimeters, 13 millimeters, and 15 millimeter. The gradual drilling protocol generates less heat and produces less discomfort for the patient. Each succeeding drill fits in the diameter of the opening left by the previous drill, or the osteotomy created by the preceding drill. Drills with the 3.9 mm depth stop should be guided by the 4.0 mm guide sleeve. This set of depth stop drills work well with Straumann 3.3 mm implants and 4.1 mm implants or implants with similar diameters. The drills are meant to be used starting with the 1.5 to 2.2 mm 6 mm long, followed by the same diameter by 8 mm long, followed by the 10 mm drill length until you get to the depth needed to place the implant, which is determined from the radiograph. Then go to the next larger diameter drill of the final depth and increase in drill diameters of the same lengths. Finally, use the Straumann drill or the manufacturer's final or profile drill before placing the implant. If you want to stick with the Straumann drills next, use the 2.7 mm drill and read the depth markings. Then the 3.2 mm drill is centered in the 3.3 mm guide sleeve. Finally, the implant is placed with the carrier using the surgical guide. If it needs to be placed deeper, one can use the implant removal tool aligned with the guide sleeve. An X-ray is taken to validate the angle of the implant with the surgical guide to demonstrate the accuracy of the implant placement. Guide right is a system of components used for making surgical guides, in office or lab fabricated, that can be evaluated and corrected with 3D imaging that allows linear and angular corrections, enabling precision implant placement. It is cost-effective if you have time to do it yourself. There are many cases presented as PowerPoint shows on our website at www.deplaque.com/resources. Be sure to check out the Crestal Sinus Elevation Protocol. All of our kits have a money-back satisfaction guarantee for 30 days. Guide right bending tool. These are the steps for a single bend correction. Care to review? Step 1. Position a straight or offset guidepost in the stylus slot with the registration mark on the post platform visible. Step 2. Using the 0.035 hex driver, tighten the stylus set screw against one of the 4 flat surfaces on the rectangular plate of the guidepost to secure it in the stylus. Step 3. Locate the 2 holes in the top of the stainless steel bending block at the bottom of the plate. Step 4. Place the lower half of the guidepost into the hole closest to the back surface of the bending tool plate. The remaining hole is only used for very large 4 to 5 mm offset posts. Step 5. In this case, rotate stylus clockwise. Step 6. Tighten the socket cap screw to secure the post in the block. Step 7. Make the first bend by pressing the stylus in the desired direction to point to the desired degree of correction.